Hello everyone. I hope I am audible and visible. And in today's session, we are going to discuss a very important topic of cardiovascular system, of the pathology of cardiovascular system. And this is important for your serious lectures as well as in medicine and in other subjects. And as per pathology point of view, this is apt and this is an important topic. In universities exams, you can get short notes and even a long question on some of the cardiomyopathies. So without any delay, let's start with the cardiomyopathies. So basically, if you see the term, I'm telling cardiomyopathy. So cardio means heart, myo means the muscle, and pathy means a pathology, right? So myopathy refers to the abnormal effect which affects the cardiac muscles basically. Okay, so it is basically affecting the it is a group of disorders. Okay, look how I'm defining it. It is not a single disorder, it is a group of disorders, okay, which affects what are the muscles in the heart? Which muscles are present in the heart? Skeletal muscles, right? Skeletal muscles of heart. And if it affects the skeletal muscles of heart, it will result in mechanical and electrical disturbances. It will result in mechanical and electrical disturbances. Okay. So it is a group of disorder which is affecting the cardiac muscles or the skeletal muscles of the heart, okay, or the cardiac muscle, and it is resulting in electrical as well as mechanical disturbances of the heart. Like is a result, it may result in arrhythmias, okay, may result in arrhythmias. It may result in some fibrillations. It may result in some you know various other disorders, the conduction defects of heart, right? So various outcomes are there of this. Okay. So basically, we got the definition. It is a group of disorders which is affecting the skeletal muscles of the heart and it is resulting in mechanical as well as electrical disturbances, right? Okay. So basically, we can have various subtypes of this cardiomyopathy. Okay, we can have dilated cardiomyopathy, restricted cardiomyopathy, and hypertrophic obstructive cardiomyopathy. Okay, this is the type. Okay, I'm going into details of this. Okay, so first of all, you just understand that it doesn't mean that every cardiomyopathy the heart will be swollen. This is a misconception that in every cardiomyopathy the heart will be swollen. Okay, of course, it is a general rule, but the definition doesn't tell us that. Definition is telling only that it affects. Okay, it is not telling that if it is causing the heart to dilate or causing the heart to be shrunk or constricted, right? It is just telling that it is affecting the heart, right? Okay, so let's go into the subtypes of cardiomyopathy, right? Okay, so the first one is called as the, I'm starting up with, let's say, dilated cardiomyopathy. Okay, dilated cardiomyopathy. So basically, this is the most common type. Okay, it is the most common type of cardiomyopathy, and we can have some genetic causes as well as some acquired causes of this condition. We can either have some genetic DCM or we can have acquired DCM. Genetic DCM and acquired DCM, right? So we can have genetic causes of this and acquired causes of this. And genetic causes, we have very characteristic. One is called the mutation, in which you will see ninja star nuclei. We can have titin gene mutation, in which you will see ninja star nuclei, right? So in genetic causes, you can have the mutation in. You must have heard that the titin gene is the largest gene, right? Mutation in titin gene. Mutation in titin gene. Okay. So mutation in titin gene will result in a genetic type of dilated cardiomyopathy. Okay, and this will be autosomal dominant in inheritance, right? And it's the largest gene. And if you see the microscopy of this, I will show you pictures at the end. So in the microscopy, you will see ninja star nuclei. Okay, the nucleus will be shaped somewhat like this. Nucleus will be shaped somewhat like this of the cardiac muscles, right? So one of the causes is this. Either you can have titin gene or you can have mutation in dystrophin gene. Mutation in dystrophin gene. Mutation in dystrophin gene, right? And this condition in which there is a mutation in dystrophin gene, you must have heard in your first year itself. This is called DMD. DMD refers to Duchenne muscular dystrophy. Duchenne muscular dystrophy, right? And this is X-linked recessive condition. This is a X-linked recessive condition, right? X-linked recessive condition. Okay. So these are our common causes of genetic type of dilated cardiomyopathy. We can have acquired types, right? So we can have either okay, one of the causes of acquired DCM. Let's say one is the alcohol, alcohol. Okay, so alcohol basically, if you know the metabolism part, you will know that the aldehyde part of the alcohol is basically cardiotoxic. The aldehyde part is cardiotoxic, and alcohol also causes thiamine deficiency. So whenever we are intaking the alcohol, the aldehyde part is damaging the heart as well as the thiamine deficiency. So thiamine deficiency is causing very right, is causing a wet type of very wet type of very, what is the most common manifestation? CNS manifestation. That is not CNS, cardiac manifestations, right? So cardiac dysfunction will be there. So whenever there's a cardiac dysfunction and cardiotoxic, both are cardiac related, right? So this alcohol is causing a acquired type of dilated cardiomyopathy, right? Second cause is myocarditis. Myocarditis. So myocarditis is basically induced by many virus. You must have heard about in microbiology. So basically, it will have a viral origin, right? And also we can have peripartum cardiomyopathy. This is also a type of acquired dilated cardiomyopathy. Okay, so this peripartum is we can have some pregnancy-induced hypertension, right? In case of example, let's write the example: pregnancy-induced hypertension. And in pregnancy, you'll see that there are some genetic predisposition. Okay, we can have volume overload of this cause. Volume overload. Okay, volume overload. Done. So volume of what do you know the difference between pressure overload and volume overload? If there is a pressure overload, you can give an analogy of a balloon being filled with air. Okay, so whenever there is the air being pushed like this is a pressure overload. This is a pressure overload. But when water is filled inside, it will be like this because the water will start depositing in the dependent part, right? So the balloon will distend like this, and this is called the volume overload. This is called the volume overload. So whenever there is a volume overload, also we can have a type of dilated cardiomyopathy. The apical portion of heart basically will dilate, right? Okay. The fifth cause, you say, is iron. Iron. So whenever there is an iron overload, okay, whenever there is an iron overload, basically, uh, you must be knowing that iron is basically causing the formation of free radicals, right? The you can say ROS, reactive oxygen species, and this reactive oxygen species is basically damaging the muscles of the heart, and causing it. Okay, and the sixth cause is stress. Okay, so how can stress lead to cardiomyopathy? So whenever there is stress, there are increased catecholamines. Whenever there is stress, there is an increase in the catecholamines level. Okay, and excess catecholamines will be causing an outpouching of the heart. If this is your heart, let's say, okay, then it will cause this outpouching of heart like this. Okay, this will cause an outpouching of heart like this, and this type of outpouching of heart due to an emotional condition like stress or any emotional condition, we can have this type of outpouching, and this is called as the Takotsubo. cardiomyopathy. This is called the Takotsubo cardiomyopathy, right? So this Takotsubo cardiomyopathy basically comes from an uh, I guess it is Japanese origin one. Okay, so in Japan, basically they keep octopus in this trap. So this type of a bag is there, and they basically what they do is they put the octopus here like this. Okay, pardon my octopus. They put the octopus like this in the octopus trap. So this octopus trap is basically known as Takotsubo. So the it is looking like the trap only. So the name is Takotsubo cardiomyopathy. And this Takotsubo cardiomyopathy is also called as the broken heart. Okay, broken heart because it is causing because of any emotional distress. Okay, so this all we discussed are the causes of your dilated cardiomyopathy. Okay. If you look at the clinical features of the heart, then there will be, of course, there will be systolic heart failure. If I talk about a bit about clinical features, then first one will be the systolic heart failure. Since the heart is basically dilating, right? So there will be problem in contraction of the heart, right? As it is dilating like this. Okay, it's a dilated cardiomyopathy. This is a contraction difficult with it will not be diastolic one. It will be mostly systolic heart failure only. Then we can have tachypnea, and you will have, of course, breathing difficulties. Breathing difficulties. Okay, all of these things are there. And if you look at the gross of the heart, if you look at the grossly of at the heart, there will be dilated chambers. Plus, there will be some as the chambers are dilated, there is volume overload, right? So we must be knowing from our general patho that if there is a overload, there will be adaptation, and whenever there is an adaptation, there will be hypertrophy in case of overloads, right? So we'll have dilated chambers plus adaptive hypertrophy. Dilated chambers plus adaptive hypertrophy, right? And if I look at the microscopy, so basically every hypertrophy, every cardiomyopathy will show a characteristic boxcar nuclei. Boxcar nuclei. Okay, the nuclei will be arranged like this. This arrangement is called the boxcar nuclei, and this adaptive hypertrophy is the region of this boxcar nuclei. Due to adaptive hypertrophy, the nucleus is arranged like this, and boxcar nuclei will be seen. Of course, we can have a specific in microscope general feature. This is a general feature. This is a generalized feature. You can have specific ones like ninja star nuclei. I told you. Specific one. Okay. And there will be interstitial fibrosis and collagen deposition. Obviously, if the heart is dilating, then we need somewhat in the spaces, right? Okay. So between two muscles, between, let's say, this is one muscle fiber and this is another muscle fiber. Between two muscle fiber, I'm drawing in blue. Between two muscle, there will be some fibers present, and this fiber is what fiber? Collagen one. Okay, and I'm drawing it with blue blue or black because it is stained with Mason's trichome. Okay, you must be knowing that one stain for collagen is Mason's trichome, right? So collagen. So there will be, I can say, the third feature is interstitial fibrosis. Interstitial fibrosis. Okay, so this was all about our dilated cardiomyopathy. Okay, dilated cardiomyopathy. And secondly, we'll go to our second type of cardiomyopathy, that is hypertrophic obstructive cardiomyopathy. The second type, hypertrophic obstructive cardiomyopathy. And this will be discussed in the next lecture. Okay, so that's all in today's lecture. I hope you enjoyed the lecture of This we started up with cardiomyopathy and discussed the dilated cardiomyopathy. And in the next lecture, we'll move on to our next one, that will be the hypertrophic obstructive cardiomyopathy. Okay, in the sequence, right? So that's all in today's lecture. And if you want to connect with me, then you can just go to Vishwanath Tripathi and okay, this is my Insta ID, and okay, you can connect with me on Instagram, right? And we have a Telegram channel named MEDVERSE by BT. Okay, that's all. So bye bye, and let's meet in the next lecture. Okay, thank you.